Video is about typhoid fever. Typhoid fever is also called enteric fever. What is the causative organism for typhoid fever? Salmonella typhi is a gram-negative rod bacteria is the responsible organism for typhoid fever. The incubation period for typhoid fever is from 10 to 14 days. Now we will discuss the mode of transmission of typhoid fever. Typhoid fever is a contagious disease which is transmitting from one human being to another through fecal-oral route transmission. It is transmitted through contaminated foods or water. As we have discussed, it is highly contagious communicable disease. Typhoid fever is more common in developing countries. Now we will discuss the clinical features of typhoid fever. Typhoid fever present with high-grade fever with chills, abdominal pain, loose motion, or sometimes typhoid fever patient presented with constipation, headache, fatigue and muscle pain. On examination, typhoid fever will have rose spots. What are rose spots? It is small red spots on abdomen and chest. How we will investigate a patient of typhoid fever? Typhoid fever patient will be investigated. First, we will do complete blood picture. In complete blood picture, patient will have neutropenia. Then we will do liver function test, which often come deranged. And then we do culture and sensitivity test according to the duration of the disease. In first week of the disease, we do the blood culture and sensitivity test. In second week of the disease, we do urine culture and sensitivity test. And in third week of the disease, we do stool culture and sensitivity test. And in fourth week of the disease, we do the bone marrow culture and sensitivity test. In order to remember these culture and sensitivity test in order of duration of disease, there is a formula to remember this BUSM. B means blood culture and sensitivity. We do blood culture and sensitivity in first week. Then U mean urine culture and sensitivity. Urine culture and sensitivity we do in second week. And S means stool culture and sensitivity. Stool culture we do in third week. And bone marrow culture and sensitivity. M mean bone marrow. Bone marrow we do in fourth week. Then often we do the PCR analysis, real-time PCR. And in previous times, we often did Vidal test. It gives inaccurate information as it cross-reacts with other infectious agents. And nowadays, Vidal test is discouraged for typhoid fever. Now we will discuss the specific antibiotic treatment for typhoid fever. Fully sensitive typhoid fever we treat with chloramphenicol or amoxicillin. In second category, in multi-drug resistant typhoid fever, we treat MDR typhoid fever through fluoroquinolones, cefixime, or ceftriaxone. And in third category, the quinolone-resistant typhoid fever, we treat quinolone-resistant typhoid fever through azithromycin or cefotaxime. And in fourth category, in XDR typhoid fever, we treat XDR typhoid fever through meropenem or azithromycin. Now we will discuss how to prevent human beings from the transmission of typhoid fever. It is through hand washing, improved personal hygiene, sanitary habits improvement. avoid street foods, protective health measures, and vaccinations. Now we will discuss the different vaccines. There are three types of vaccine we often advised to prevent typhoid fever. The first vaccine is oral live attenuated preparation of Ty21A strain vaccine. The second category of vaccination is purified VI capsular polysaccharide. And in third category, typhoid conjugated vaccine TCV. Now we will discuss the complication of typhoid fever. It is enteric encephalopathy. Typhoid fever also causes acute cholecystitis, hepatitis, pneumonia, pyelonephritis, meningitis, osteomyelitis, septic arthritis, and bone marrow suppression.